Clostridium botulinum was first discovered and identified by Belgian microbiologist Emile Pierre van Erminghem in 1895. He isolated the bacterium while investigating a botulism outbreak in Ellezelles, Belgium, which occurred after a group of people consumed contaminated smoked ham at a funeral. Van Erminghem's research was crucial in establishing the link between the bacterium, its production of the botulinum toxin, and the symptoms of botulism. Clostridium botulinum itself does not typically cause infection. Instead, it produces a potent neurotoxin called botulinum toxin, which is responsible for the symptoms of botulism. There are several ways in which humans can be exposed to the botulinum toxin, leading to the different forms of botulism. Foodborne botulism. This occurs when a person consumes food contaminated with botulinum toxin. The toxin is produced by C. botulinum when its spores germinate and multiply under anaerobic, oxygen-free, moist, and low-acid conditions. Improperly processed or preserved foods, such as home-canned low-acid vegetables, preserved meats, and vacuum-packed fish, are common sources of foodborne botulism. Infant botulism. This form of botulism results from the ingestion of C. botulinum spores, which can germinate, multiply, and produce toxin in the infant's intestines. Infants under 1 year of age have an immature gut microbiota, which makes them susceptible to colonization by C. botulinum. Honey is a known source of spores and should not be given to children under 1 year of age. Wound botulism. This type of botulism occurs when a wound is contaminated with C. botulinum spores. The spores can germinate and produce toxin within the wound, leading to botulism symptoms. Wound botulism has been associated with injecting drug users who introduce the spores into their tissues through contaminated needles or skin popping. It is important to note that botulism is not transmitted from person to person. Instead, exposure to the botulinum toxin occurs through ingestion of contaminated food, the germination of spores in the intestines of infants, or the production of toxin in a contaminated wound. Clostridium botulinum itself does not cause symptoms. However, the potent neurotoxin it produces, called botulinum toxin, is responsible for the symptoms of botulism. The toxin interferes with the release of acetylcholine, a neurotransmitter essential for muscle contractions, leading to muscle paralysis. The symptoms of botulism can vary, but they typically include blurred or double vision, drooping eyelids, ptosis, slurred speech, dysarthria, difficulty swallowing, dysphagia, dry mouth, facial weakness, progressive muscle weakness and paralysis, which can spread to the arms, legs, and trunk, respiratory distress and difficulty breathing, which can occur as the toxin affects the muscles responsible for respiration. Symptoms of botulism usually appear within 12 to 72 hours after exposure to the toxin, although the onset can be sooner or later in some cases. Botulism is a medical emergency, and prompt treatment with an antitoxin is necessary to neutralize the toxin and prevent worsening of the symptoms. In severe cases, respiratory failure and death can occur if left untreated. The treatment for botulism, which is caused by the botulinum toxin produced by Clostridium botulinum, focuses on neutralizing the toxin and providing supportive care. The primary treatments include antitoxin. As soon as a diagnosis of botulism is suspected, an antitoxin is typically administered. The antitoxin works by neutralizing the circulating botulinum toxin in the bloodstream, preventing it from causing further damage. It is important to note that the antitoxin cannot reverse the paralysis that has already occurred, but it can help prevent the progression of symptoms. In the United States, a heptavalent botulism antitoxin, HBAT, is used to treat adults, while a human-derived antitoxin called Baby Big is used for infant botulism. Supportive care. Patients with botulism often require supportive care to manage their symptoms. This may include mechanical ventilation to assist with breathing if the respiratory muscles are affected, intravenous fluids and electrolytes to maintain hydration and electrolyte balance, and nutritional support, as swallowing may be difficult. Wound care. In cases of wound botulism, the infected wound needs to be cleaned and debrided to remove any necrotic tissue and reduce the bacterial load. Antibiotics may be prescribed to help control the infection. Rehabilitation. After the acute phase of the illness, Patients may require physical and occupational therapy to help regain their strength and functioning. Prevention is key in managing the risk of botulism. This involves proper food handling and preservation techniques, avoiding the consumption of potentially contaminated food, and not giving honey to infants under 1 year of age. In the case of wound botulism, proper wound care and hygiene can help reduce the risk of infection.